Okay, hello. My name is Isabella Bryden. For this applied assignment, I chose to do inclusion in healthcare. So here's my table of contents. It's going to go over my topic, reason for my topic, my interview, different things that I used for my research, what I learned overall, and then what I would choose to continue to inquire on after my research. Getting right into it, my topic is, like I said, disability inclusion in healthcare. I chose this topic because recently my father-in-law has been diagnosed with some disabilities that have been impacting his speech and his ability to, his mobility overall due to some stroke symptoms. So, with that being said, I wanted to touch specifically on the aspects of inclusion surrounding quality of care for people with disabilities. So for my interview, I did choose to do my significant other because it is his father who is disabled. And prior to this, I had pretty minimal background knowledge, besides the fact that my significant other is his father's power of attorney, and he's the only family available to assist in his care. So he plays a direct role in his father's care and communication with his healthcare provider. So any um, direct care that his father is getting from any nurses or rehab facility workers, they are going directly through AJ, and we get to kind of see that one-on-one. We've had some firsthand interactions with things that we didn't quite like, and we'll get into that later with the actual interview notes and the research. But I've gotten to witness him in action over the last few months of assisting in his father's care, so that's why I chose to interview him. The course materials that I chose to use were Equity, Caregiver Power, and Disability Policy, as well as the Department of Health and Social Care. And I used these for researching what power the family has in decision making surrounding healthcare for people with disabilities, and also just for general information surrounding my topic. Um, with that being said, in terms of power that family has in decision making, it's pretty minimal. Unless you have the power of attorney, like in my partner's case with his father, the person with the disabilities are the ones that are making most of those calls, unless it's life or death, or they're unable to make the decisions with sound mind. Um, and then it goes to next of kin or your spouse, which in my father-in-law's case, he actually doesn't have anybody that he's married to, so it would go straight to AJ, even without that power of attorney, if he wasn't able to communicate his choices himself. Um, Other research that I found myself were prevalence of disabilities and healthcare access by disability status and type among adults. So that's going to be more of the statistics surrounding difficulties of gaining access to healthcare, and then also disability attitudes in healthcare. I also, one that's not on here, is I did find an article written by Ryan Williams, which I did source at the end of my presentation, and he gets to talk a little bit about um, what it's like to have somebody speak to you in a way that isn't really a social norm based off the fact that he is disabled. All right, getting into my evidence. This is just my text confirmation between my partner and I, of when we were going to do the interview, and then some of the notes that I took. Getting into that new learning. So speaking about that or the article that was written by Ryan Williams, a disabled man, he is paraplegic, and something that he felt was really important to tack in there was that people often assume that he's really fragile, and that they can't hear him, or that he cannot hear people properly. So they talk really loudly in his face, making assumptions that are inaccurate. But really, his hearing is just fine. And on that same note, my partner mentioned something in our interview that care providers really seem to lack patience with him, like with his father, and that if they took the time and were a little bit more patient to let his father try to do things on his own, he would be a lot more able. But after a while, it just gets a little bit discouraging, and he doesn't really feel like he wants to try anymore. So, with that being said, I think it's important to highlight that people who do not experience disability often make a lot of assumptions about what someone with a disability can and cannot handle just because they're limited in one area. It doesn't mean that they're incapable of everything else. So going back to that hearing thing, specifically with my father-in-law, because he is now nonverbal, they often assume like, oh, he might have a hard time understanding the words that are coming out of my mouth. So I'm going to talk a little bit slower, a little bit louder, enunciate my words, when really you can just talk to him just like we would in a normal conversation, and he can understand everything just fine. He might just respond with like a thumbs up, thumbs down in the middle. Um, we've kind of worked on getting our own way of communication, which has been pretty cool to watch. Getting into access, something that's really important to touch on is that the biggest barrier to people with disabilities is getting the care that they need and their access to the healthcare system. And oftentimes it's due to the expenses and the lack of consistent healthcare providers. So specifically, according to the CDC, in 2016, they discovered that the prevalence of this barrier is often in not being able to have a healthcare insurance coverage that is consistent, or having a usual healthcare provider like a primary care physician, or receiving a routine checkup every 12 months, just like we would in our routine care as somebody who's non-disabled. So oftentimes those needs are being unmet. Um, and sometimes that can be because we people who may not have disability are a little bit more consistent in our jobs, and oftentimes that health insurance is actually from our career, and we don't have to think about it. It's not something that we actively enroll in or pay towards. It just comes right out of our paycheck. But somebody who's disabled and might not be able to work, like Ryan Wilson, for example, who is paralyzed and unable to do any physical labor or even sitting at a desk, really, um, they might not be able to just get a healthcare provider from their jobs. They might even not even have jobs. So that barrier is a little bit more in depth and takes a lot more research and a lot more effort, which they might not know how to do on their own. And in terms of equity, something that I learned from an article, oh gosh, which one was it? I believe it was It was the prevalence of disabilities in healthcare access, um, based off type. So something from that article was that people with learning disabilities are at a much greater risk of dying earlier due to poor health care. And going back to that access slide, this is because they don't have that same access that we do as somebody who might not be disabled to consistent healthcare, and they might have a bit more of an experience with that financial barrier, not being able to afford the healthcare that they need, especially considering people with disabilities may require more attention from a healthcare provider. And they are already struggling to just get the typical standard amount. All right. And with that all being said, if I were to continue to inquire on this topic, I would want to research how disability impacts the cost of healthcare. So things that I might look up would be common types of care that people with disabilities may need, the cost of that care, and whether or not having a disability impacts the cost of care. So insurance companies typically have a predisposition with pre-existing conditions, so they might not cover as much, or if the price alone just varies because they have that disability versus somebody who might not present with a disability. And then question for my peers would be, what questions might you have for my partner's father and his opinion of the quality of his healthcare? And these are all of my sources right there. All right.